story is, yes, I'm internal medicine. I've been practicing at the beaches for 25 plus years. And I did hear about Protandim 2009. Patients would bring me the bottle and say, what do you think of this? What do you think? Should I take this? And I would look at it and say, looks great, take it, knowing nothing about the product. And then, as Gabe said, he brought Dr. Joe McCord to University of North Florida in October 2010. A retired anesthesiologist who was my patient taking the product said, you got to go hear this guy speak. You got to do this or I'll never talk to you again. So I said, okay. So I called Bill and I said, Bill, we got to go to University of North Florida tonight and hear a PhD talk about a nutritional product. And we went, and I didn't have a great attitude. I didn't have a bad attitude. I just kind of was like, okay, we'll go hear this. And we sit in the chairs and Dr. Joe McCord comes out and starts talking about our flagship product, Protandim Nerve 2. And I absolutely was on fire. I mean, the hairs on my neck were standing up. I turned to Bill. I said, this is history in the making. We need to be on this product forever and ever. And that was kind of the start of my story. Did not know about network marketing, did not understand network marketing, but have loved being involved in it. It has changed me. It has challenged me. I have grown more actually as a person in this network marketing industry than actually in my practice. I love my practice. I love what I do. I love my patients. I'm blessed to be a physician. I feel like it's been a gift from God. So I love that, but it has been a personal change and a personal growth for me with network marketing. So I really can't tell everybody. I'm going to talk about the products, science, science, science. I love the products. They're fantastic. But I also want everybody to listen to all the other speakers about the industry of network marketing because I think it's fantastic. And Dr. Harris just blew it out of the park there. That was fantastic. So I'm going to talk about, we have a lot of products and it gets stressful for people, what to do, what do you need to take? Well, of course, they're all fantastic, but I'm going to particularly talk about our stack. We call it the Vitality Stack. And that is our Protandim Nerve 2, our Protandim Nerve 1, our probiotic, and our omega fish oil. So I'm going to talk about that, and I'm going to kind of try to bring it together for you in the conversation of cell health. So our company's moving towards that, cell health, nutrigenomics, taking nutrition to positively influence your genes, biohacking, being the best you can be by nutrition and other, we have our t-shirt, the biohacking t-shirt with the definition, using cutting edge science to become the absolute best version of yourself. So biohacking, nutrigenomics, and I like to use cell health. And we have 37 trillion cells in our body, 37 trillion cells. And wouldn't it be nice to do the best you can for those 37 trillion cells? Because boy, they're doing the best they can for you despite all our bad habits and all our pollution and all our problems, disease, infection, etc. So the 4 products together, the Vitality Stack, work actually at the cellular level and they all enhance each other. The 4 things that damage our cells the worst, I call them the 4 evil forces, are oxidative stress, and that is basically the free radicals we create by eating and breathing, okay? It's just like your car makes carbon monoxide, our body makes free radicals, and those free radicals then attack us. So we have oxidative stress, which is the free radical damage. We have mitochondrial dysfunction, and mitochondria are our engine of the cell. They're our JEA powerhouse. We have immune dysfunction, which is our immune system being damaged by our environment, etc. And our immune system is so important, so we have immune dysfunction. And then we have inflammation. And so those are the 4 evil forces, as we say. And we're going to start with oxidative stress. I particularly think oxidative stress is number 1, okay? And we have the product that treats oxidative stress. Our product is our Protandim Nerve 2 activator, okay? This was our flagship product. What is Protandim Nerve 2? Protandim Nerve 2 is 5 natural ingredients. Ashwagandha, which is an Ayurvedic product that helps with adrenal stress. Bacopa, another Ayurvedic product for mental clarity. Turmeric, green tea, and milk thistle, okay? And that is our Protandim Nerve 2. When I heard Joe McCord speak about Protandim, I had not had the pleasure of seeing the video, but if you watch the video, and most of you have, I do believe, it sort of goes back in time, gives us a description. What happened is Joe McCord was at Duke in the 60s doing his doctorate. At that time, he discovered that we had DNA. They're called our survival genes. We have DNA. We have about 25,000 plus genes. And we have a set of survival genes that make antioxidant enzymes. And when these genes make antioxidant enzymes, they actually decrease our oxidative stress in every 37 trillion cells by an average of 40%. Wow. So you have the ability to make antioxidants that decrease oxidative stress in your cells an average of 40%. Okay, guess what? We quit making those antioxidant enzymes as we age, somewhere in our 20s. We keep doing that. And that was discovered. So Joe McCord started the search in the 60s, learning that we have survival genes that make antioxidant enzymes. Then in the 90s, another free radical biologist discovered NRF2. He discovered that we have protein messengers, a protein messenger particularly for antioxidant enzymes called NRF2. And this protein messenger talks to those survival genes, that DNA, and says, make those antioxidant enzymes. So what's happening is as we age, our protein messengers are bombing out. They're getting tired, they're quitting, whatever. So the push became after the 90s is to figure out how to wake up those protein messengers, how to activate those protein messengers. And we did it. The pharmaceutical industry is trying to do it. They have 2 NRF2 activators that got pulled off the market. They now have 1 NRF2 activator that is for multiple sclerosis. It's a $5,000 a month, and you have to be a doctor. You have to have multiple sclerosis to get it, and you have to get it from a doctor. We have a NRF2 activator that's $40 a month, as Dr. Harris mentioned, and we actually beat that other NRF2 activator in 2010 in some studies. So that was quite exciting for us. So we have the NRF2 activator. You will see other nutritional companies trying to make NRF2 activators. It is now mainstream. You know, a lot of things haven't really happened in our lifetime. We didn't discover antibiotics in our lifetime. We didn't discover that the world was round in our lifetime. You have to realize that we have a discovery here that is going to change science as we know it, and we're living this. But you also have to not be negative and be skeptical, et cetera, when you have 23 peer-reviewed studies, you have universities studying our product, et cetera. So we have the NRF2 activator for oxidative stress, and that is our Protandim NRF2. When we talk about it, we have the studies that support it. We have 23 peer-reviewed studies. The first peer-reviewed study, and don't worry, I'm not going to go through all 23. The first one was that live interview with Joe McCord and the reporter. They did, that was a study. They took healthy humans, measured their oxidative stress levels, gave them all Protandim NRF2, and then remeasured their oxidative stress levels. And every single person in the study lowered their oxidative stress levels an average of 40%. So that means that we have a product that lowers oxidative stress in every 37 trillion cells of your body. The other studies led to there's a study at LSU for skin, and that led to our skincare line, which I'm just going to briefly comment on, that too has NRF2 activation. Our skincare line talks to 25 genes of our skin, upregulating repair genes and downregulating damage genes. Wow, there's nothing like that on the market. And that was our third peer review that led to that. So we have an incredible product with incredible data to back it up. And it shocks me sometimes when people don't get that, but that is our Protandim NRF2. So as far as oxidative stress, free radical damage, we have it locked up. We have the product, and every single person should be on this product. You know, we talk about, well, what do I need? What do I want? You need this. This product lowers oxidative stress in every 37 trillion cells of your body. That is a tremendous help for your health. So this is our first line of our vitality stack. The next is our Protandim NRF1. Well, Protandim NRF1 actually is for mitochondrial dysfunction. So what happens is as we age, the oxidative stress damages our mitochondria. And mitochondria are the powerhouse of our body. They supply 95% of our energy. Probably every single disease is associated with mitochondrial dysfunction, especially neurological diseases, dementia, Parkinson's, MS, multiple diseases, and they're all associated with mitochondrial dysfunction. So we now have the protein messenger that activates the genes that make better and stronger mitochondria, and that is NRF1. Now, interestingly, NRF2 is big N, little r, little f2. NRF1 is big N, big F, big R1. So this is something you will be learning about, how many protein messengers are out there. We're just starting this. And we actually, our company, LifeVantage, is on the cutting edge of all of this. So we have a product that makes you bigger and better mitochondria, NRF1. So these two together are synergistic. They're married together. Decreasing oxidative stress, that already helps your mitochondria. Making more mitochondria, that helps every cell in your body again. So this is a great powerhouse. And those are the first parts of our vitality stack. The next part is our probiotic. So the fun part about all of this is that probiotics have been around for years. And the natural world has been talking about probiotics for years. The problem is, we now have realized, and I think Hippocrates said it the best 2,000 years ago, all disease starts in the gut. You got bad gut bacteria, you got bad DNA happening. You got good gut bacteria, you got good DNA. So we need better gut bacteria. What happens to our gut bacteria? Well, you're born, you got strep throat, you get an antibiotic. You got an ear infection, you get an antibiotic. Then you got acne as a teenager, you get an antibiotic. You got a urinary tract infection, you get an antibiotic. You get diverticulitis, you get an antibiotic. And so over the course of our life, we are just killing our gut bacteria, and therefore bad results. The gut bacteria is responsible for making our immune cells. Our immune system starts in the gut. So everybody has known we need probiotics, and the problem is you only get 4% of the bacteria in a probiotic into your gut. The skeptic people are probably right, saying, hey, you don't get the bacteria. And is the bacteria even alive? It's been in the storehouse. It's been in the, the grocery store warehouse, no good, no good. So we came up, as we always do, with the best probiotic. Our probiotic has 6 bacteria in it, 6 of the big bacteria that you want for your gut. We get, because of our delivery system, we get 60% of these 6 billion bacteria into our gut. The delivery system is patented system, and it's fantastic. The other fantastic thing about our probiotic is there's an immune enhancer product in here as well that enhances our immune system to make better macrophage and monocytes, which are the 2 first line of defense for viruses and infections. So our probiotic is amazing. And again, price-wise, all of our products are priced better than most products that aren't half as good, 1/10 as good over the counter. So we have the best probiotic. And I think the fun part about it is that how many people take probiotics. Sometimes it does get hard talking about NRF2 and NRF1 with people. I mean, decreasing oxidative stress, improving your mitochondria, hopefully that makes it simpler for people to understand. But everybody I know takes a probiotic, and I look at them going, oh, you're kidding me. We have the best probiotic. So that is right there, part of our vitality stack. That is number 3. And the last part of our vitality stack is our omega fish oil. Again, fish oils are very important. You've heard about them for a long time, but it goes back to quality. We have the quality that you want as well as price, but the quality. We can follow and trace this omega fish oil back to the boat. They call it boat to bottle. We have got the omega-3, which helps with inflammation. And that, again, our 4th evil force is inflammation. Helps with inflammation. It helps with your eyes, your brain, your heart, everything, your skin. So omegas are very, very big. They help with cholesterol. They help with multiple things. But our fish oil not only has the omega-3, which is on every corner, it has omega-7. And omega-7 is for metabolic syndrome. It's for belly fat. So we have, and you're going to hear more about omega-7, but where do you hear about it first? LifeVantage, of course. So we have omega-3 in here. We have omega-7. And we have vitamin D. And I've been preaching vitamin D for 20 years. Vitamin D is very, very important. It is best absorbed when mixed with fish oils. That would be cod liver oil, one of God's perfect foods, which tastes terrible, but not for our wonderful fish oil. So we have the vitamin D in here with the omega-3 and the omega-7. You could not ask for a better absorption, a better product. And that is what we call the vitality stack. So that when we talk about these products and all of the science, it can get you bogged down. It can get you, tongue-tied. Do not You do not need to be a doctor to do this business. You do not need to go after the science with people. They can go find the science on the websites. They can go find Dr. McCord talking about the science, me talking about the science, other doctors in the company. I think there's over 300 something, 70 doctors in the company right now. So they can find doctors talking about the science. You don't have to be that person. But what you need to know is the Vitality Stack, those 4 products, and now we have got it in an easy, an easy to use little, whatever, I don't know what you call this, dispense packets, easy to use packets. That's what everybody needs to be on. That is the cornerstone. That is the starting point of all these products. Everything in the company works better off of this Vitality Stack. You've gotten Protandim Nerve 2, Protandim Nerve 1, our fantastic probiotic, and our wonderful fish oil. Can't say enough. And this, the packets, which comes like this, a little box, and you just take a packet each day, is great. It's great for travel. It's great to throw in your purse or your wallet, your pocket, or wherever, so that you have the Vitality Stack. When we talk about this, because we have so many other products, we have also a weight management line. The weight management line works better when you are dealing with better mitochondria, decreased oxidative stress, because there's terrible oxidative stress with fat cells as well as all our 37 trillion cells, and you're doing better gut absorption with the probiotics. So bottom line is, this is our starting point. This is our starting point. And again, we have a great weight management line with the best protein shake on the market. We have a protein shake, which is whey and casein protein, 12 grams of protein, 2 grams of carbs, 70 calories. Are you kidding me? It is fantastic. We have a fat burn, which kind of combines 2 herbs that help burn belly fat. So we have all these other fantastic products. The skincare line, like we talked about, talks to 25 genes of your skin. All fantastic. But really the cornerstone, the starting point is our Vitality Stack. And I think that's where the distributors have it. Just don't try to describe it all, but this Vitality Stack is what you need. So people say, what do I need to take? What should I, oh, this is so confusing. What do I take? What do I need? This is it. You need the Vitality Stack. That's what you need for oxidative stress. Remember, 37 trillion cells, we decrease oxidative stress an average of 40% in every 37 trillion cells. That right there, I get a little bit, I don't know if I get a little bit of a smarty pants about it, but I can't get how someone doesn't want to take that product. I mean, and people ask me questions, oh, this. Oh, what about my other doctor? My doctor said this. I'm like, stop. You have a product here that's all natural, $40, that decreases oxidative stress and 37 trillion cells of your body. Conversation over. I can't help you there. We have the mitochondrial dysfunction. Every disease is associated with mitochondrial dysfunction. We have a product now, a protein messenger that activates better and bigger, making our DNA to make better and bigger mitochondria. And then we have the probiotic for immune dysfunction. We're such an immune dysfunction country. It's amazing. And we have the product. And then for inflammation, we have the fish oil that is the best on the market, the cleanest on the market, the purest on the market. We had one of the elite academies. They make you bite the fish oil. I tell you right now, if you bit into a prescription fish oil, you would throw up. Our fish oil, you could bite into it, then clean as a whistle, won't bother you at all. So we have the products. And the thing that Dr. Harris mentioned too, with the price point, I mean, we are priced better than most products over the counter. Our competing products, we are priced better and we are far superior. There's nothing to compare to us. There's no Nerf 1, Nerf 2. There's the probiotic with the delivery system and the immune enhancer. I can't say enough about it, but I want everyone to know that the Vitality Stack is the best way to introduce the products, because this is the cornerstone. And again, there's data, there's peer reviews, there's more and more information coming out, and we are cutting edge. And that's important to remember. When you're cutting edge, you have to be brave, you have to be strong. And like I said, sometimes I talk about, Christopher Columbus, when the world was, flat, and he's going out in the boat and everybody's like, he's crazy. But there were some people who said, I'm not going with you, but I hope you're right, buddy. Right. And then we have, he was right. And we still have the Flat Earth Society that believes the earth is flat. So if you're talking to someone who's in the Flat Earth Society, stop. Let's go to someone else. Get them involved in the Vitality Stack, and you're doing them the biggest favor for their health.